Yeah, hi, this is Timothy Powell, and I wanted to go over some national sources of public data. And so, if you look to the screen to my left, you can see that here are some of the sources we have. And we would start with the Center for Medicare and Medicaid Services, or CMS. So, CMS oversees the Medicare and kind of, in a way, the Medicaid services, even though there's 50 different Medicaid plans. CMS oversees Medicare and Medicaid services, including a whole lot of data, public data that comes out of that. It's going to include things like the Medicare cost report under the Healthcare Reimbursement and Information System. It's going to include the National Provider Identifier, or MPI database. And it's also going to include things like the Part B database of Part B reimbursement to different providers based on their individual procedure codes. Next, we have the Healthcare Cost and Utilization Project, or HCUP, is a by provider listing of utilization for different institutional providers. We also have ResDAC, which is the Research Data Assistance Center, which, even though it's selling you public data, even though you're getting public data, it's very, very expensive, but the data can be quite useful. It includes claim level detail from maybe a little ways back. It's not current, but it's claim level detail of both Medicare and Medicaid. We also have the United States Census Bureau provides detailed demographic, economic, and geographic data. So if you want to know how many people live in a zip code, you want to know how much money that they make, you want to have a breakdown by gender, then the United States Census Bureau data is where to go. And as an overall catch-all, which actually contains a bunch of these other data sets I'm talking about, the government has created data.gov, which is a comprehensive repository of U.S. government data. So it includes these other sites, but sometimes it's easier to go into the individual sites and look for it. But data.gov has these data sets, as well as an expanding number of other data sets. We also have the Bureau of Labor Statistics, which is where we get things like the Consumer Price Index, unemployment and employment information, pay and benefits, labor market data. So, that's an important site. If you're involved in education, I'm mainly involved in healthcare, but if you're involved in education tangentially, you have information from the National Center for Education Statistics. So this is the primary entity for collecting and analyzing data related to education. And finally, of the sources that I'm listing, we have the Centers for Disease Control, or the CDC. So the CDC provides extensive related data, including disease data. So you're looking at clinical data, not so much financial data. But if you want to know how many people had COVID or how many people had certain types of diseases, there are these large clinical data sets that also can be integrated with financial data if you're focused on financial data, like I am. So that being said, these are the major sources of national sources of data, but it's not an absolute complete list. But this is enough to get you started.